Hello everyone, myself Swami Smita Virbhadra. I am student of Shivlingeshwar College of Pharmacy, Almala, Latur. Today I am here to discuss about the peptic ulcer disease. This is one of the assignment given by our pharmacology teacher Kavita Sirgire. This is the disease which is caused due to increased secretion of the acid in the stomach, which leads to the indigestion. Basically, it is the ulcerative disease of the gastrointestinal tract. Let's discuss about this more. So basically, peptic ulcer is the disease in which there is a sore or hole to the lining of the stomach or the first part of the small intestine, that is duodenum, due to erosion caused by the stomach acid. As we know, there are the four linings of the stomach. First one is the mucosa, submucosa, muscularis and serosa. So when we focus on the types of the peptic ulcer disease, it is majorly classified into two ways. The first one on the basis of the location, and the second one is the basis of the condition or severity. So let's see it. So basis on the condition, duration or the severity, the peptic ulcer disease is classified into two ways. The first one is acute ulcer and second one is the chronic ulcer. So in acute ulcer, there is the superficial erosion of the GI tract mucosa with an acute inflammation, has short duration and it can be treated easily. So in chronic ulcer, it has a prolonged duration, it can't be treated easily, and the main sign is that it leads erosion through the muscular walls, which is the main symptom of the chronic ulcer. And when we focus on the types of peptic ulcer disease on the basis of location, it is classified into two ways. The first is the gastric ulcer. In this, the ulcer develop in the mucosal lining of stomach, and second one is the duodenal cancer. In this, ulcer is developed in the first part of small intestine, that is duodenum, and it accounts about the 80% of all peptic ulcer. When we see the pathophysiology, due to the etiological factors, there is the increased secretion of the HCl and decreased secretion of the mucus, which leads to breakdown of the mucosal lining of the stomach. So what? Acid enters in the gastric mucosa and which leads to the peptic ulcer. So when we discuss about the etiology and risk factors, so main etiology is the H. pylori infection, which is major cause for the peptic ulcer disease, and the second major cause is the non-steroidal anti-inflammatory drugs, antiplatelets and the corticosteroids. And the risk factors are the smoking, alcohol, stress, genetic factor, certain medical condition, and the additional factor is the weak immune system, which can be major cause to get infected to the peptic ulcer disease. When we focus on the clinical manifestation of the peptic ulcer, there is the burning sensation and the stomach pain in the middle part of the stomach. In duodenal ulcer, pain occurs in 2 to 4 hours after meal or mid-morning. And the additional clinical symptoms are the indigestion, bloating, nausea, unexplained weight loss, fatigue, giddiness, and in severe cases there is the blood in the vomiting. And the diagnostic parameters are the history collection, like if suppose a patient is smoker or alcoholic, and the second one is the medication history. If suppose patient is continuously administering non-steroidal anti-inflammatory drug, antiplatelets and the corticosteroids, in such cases this can be diagnostic parameter to peptic ulcer. And the second one is the physical examination, and the third one is the endoscopy, in which there is the direct visualization of the ulcer. And the fourth one is the barium swallow, in which there is the X-ray imaging after swallowing a barium solution. And the fifth one is to detect the H. pylori infection, there is the examination of the blood and stool, and also includes the breath test. And the sixth and last diagnostic parameter is the biopsy of the ulcer tissue. In the peptic ulcer disease treatment, doctor prescribed such medications like proton pump inhibitor, which decrease the secretion of the stomach acid, like omeprazole and pantoprazole. Also, there are prescribed antibiotics in case of the bacterial infection of the H. pylori, that is Helicobacter infection. And again, in treatment, antacids and H2 blockers are prescribed in case of increased secretion of the acid in the stomach to give a symptomatic relief, like a ranitidine. In 2020, United States of Drug and Food Administration reported that ranitidine includes one of the harmful substance, that is N-nitrosodium methylamine. So ranitidine is completely banned. Also, cytoprotective agents are prescribed to help to protect the stomach lining erosion, like misoprostol. To cure peptic ulcer disease, it demands some lifestyle changes like smoking cessation, low consumption of the alcohol, avoiding non-steroidal anti-inflammatory, managing stress, etc. So in the severe cases of the peptic ulcer disease, there are some surgical treatments like ulcer resection, in which there is the total removal of the ulcered part. It is done in the severe condition. And the second one is the vagotomy, in which there is the cutting of the vagus nerve, which leads to the sensation to the brain to produce acid secretion. And the third one is the pyloroplasty, in which there is the widening opening between stomach and the duodenum. When we focus on the complications, there is the major complication is the bleeding, which can lead to the anemia or the hemorrhage. Again, perforation, in which ulcer erodes through stomach or the small intestinal lining, which leading to the medical emergency. Again, major complication is the obstruction, which leads to swelling and scarring, may cause blockage of the digestive tract. In peptic ulcer disease, there is the increased risk of the stomach cancer, particularly with long standing of the H. pylori infection. The last complication is the dyspepsia, which means indigestion. And the last point is the role of pharmacist in the peptic ulcer disease. So the role of pharmacist is to collect the medication history, to assess symptom, to identify risk factors, and the main and important role of pharmacist in the peptic ulcer disease, like in severe cases like bleeding, to refer a patient to the physician. So guys, this is the brief overview about the peptic ulcer disease. For such disease, subscribe my YouTube channel. It's Elite Smita. Thank you.